Hello and welcome to our fifth and final blog on how to build effective in vitro assays for early drug discovery. In our previous vlogs, we've offered you a range of practical advice on bioassay design and development.
Here we address some common challenges you might face and discuss how to overcome them. How do you define a hit compound?
Usually, when a compound has an activity greater than the statistically defined noise of the bioassay and has shown this activity consistently when tested multiple times, then it's called a hit. But how do you define this in practice?
If you screen 1,000 compounds in your bioassay, you can rank them based on their activity. Look to determine the change observed for these compounds when compared to your controls and calculate this as a percentage. By plotting this as a distribution of percentage activity on the x-axis versus frequency on the y-axis, you can then logically apply a cutoff to identify the active compounds to retest. What plate format and layout to use for developing bioassays? The multi-well plates used in bioassays come in different densities, that is, 6, 24, 48, 96, 384, 1536 wells. But the format you decide to use will depend on how many compounds you will be testing and the cost of your reagents.
For example, if you use 384 well plate format, you can screen more compounds at a time and decrease the well volume. So you can use your reagents more efficiently and make your experiments more cost effective.
What dilutions to use for a dose-response experiment?
Performing a dose-response experiment of your standard in a bioassay can give you greater insights into the effects of a compound. But what are the optimum dilutions to use?
A good place to start is to use either 1 and 2 or half-log dilutions. Also, determine the maximum compound concentration your bioassay can cope with, that is, the tolerance of the bioassay to the solvent DMSO to prevent toxicity issues.
In this vlog, we've touched upon just a few hurdles that you may encounter in your bioassay development, but of course there'll be more. For example, what do you do if the Z prime of your bioassay is less than 0.5? Or if you can't assess a pharmacological tool or reference compound? We've addressed all this and more in our free ebook. Ensuring your research makes the biggest impact means staying up to date with the current fast pace of innovation in drug discovery.
In our free ebook, you can read about some of the most exciting emerging bioassay technologies, such as 3D cell culture and acoustic mass spectrometry, that could help you to accelerate the success of your drug discovery program.
If you'd like to discuss a contract research project with us, contact us by following the link in the description. We're a team of dedicated scientists with years of drug discovery experience. We'd love to hear from you because we are determined to help you discover the next breakthrough drug.